Welcome back. Coming up, we'll meet Britain's oldest dominatrix to delve into her fascinating world of desire. Don't miss that at 10:30.
First of all, Dr. Nighat is here with a look at the health stories that matter to you and your family. Good morning.
Good morning.
It's lovely to see you. Let's begin first of all with this then. So the report suggests that GPs are being forced to care for 2,200 patients each because of the NHS staff shortage. So within your own surgery, are these numbers, is this familiar to you?
Incredibly familiar. This is nothing uncommon to a lot of GPs that are practicing. Look, COVID, unprecedented demand, we've had staff shortages. They've just added so much pressure into general practice, and we're seeing that pressure mount and mount, and we're seeing the frustration from patients who can't get appointments with the GP. Now, nationally, even before the pandemic, we had about 5,000 shortage of GPs and healthcare professionals. Then the pandemic hit, and we were then all siphoned off to do vaccination programs and just basically firefight, which has just led to loads of exhaustion. So I'm seeing that and burnout amongst my colleagues so much at the moment.
Well, the figures come after NHS Digital revealed that GPs are rushing through a fifth of appointments in 5 minutes or less.
Yeah, and that is really the reality that I'm facing. We get 10 minutes per patient anyway, but a lot of our patients will come in because they've been waiting sometimes 2 years to come through the doors. They'll have a list of things that I'm going through. I mean, last Friday when I did a clinic, I said, look, I'm running 2 hours behind in my surgery, and my patients were just absolutely lovely. They waited, they didn't moan at all, they didn't complain. They were just grateful to be seen. But that's not sustainable because I was absolutely exhausted. Yeah. And the difficulty is that we're seeing that a lot more. Morale is just so low. Exhaustion is so high. If I can give you some statistics, just in January 2021, the National Office of Statistics says that 850 healthcare professionals in the NHS died from COVID. We've roughly got 52,000 NHS colleagues who are sick with COVID and long COVID symptoms. So they're not able to come into work and work to their full capacity. And the thing is 1 in 4 GPs in Britain know colleagues who have taken their own life due to work pressure. These are the pressures that we're talking about. And Rebuild General Practice have just revealed their latest figures that 84% of GPs admit depression, burnout, mental health conditions, exhaustion, that they're having to step away from their work.
So for you, professionally, what's the answer here? Because it doesn't sound like there's a short-term solution.
Yeah. I think it comes by just all the shareholders and the teams working together, incredible GPs who are still day in, day out slogging and just saying, look, this is the pressure that we're under. Unfortunately, media campaigns just this morning, the Daily Mail and lots of other newspaper headlines saying, where are the GPs? And the GPs are, almost shirking away from their work. I can tell you, as an NHS GP who works 3.5 days, I can tell you when I'm in there, it's my 14 to 15-hour shifts, and sometimes without a sip of water or lunch or even a wee break because I'm just so desperate to get through the list of patients that I've got. The thing is that I'm also aware of burnout as well, and colleagues are stepping in for other colleagues who go off sick. And I'm so concerned about the mental health of my colleagues. Like I said, 1 in 4 of us know someone who's taken their own lives. So there is a website available for colleagues who are struggling, anyone in the NHS. There's NHS Practitioner Health that's available for free for advice. So please, please don't suffer in silence if you're struggling with your workload at the moment.
Let's move on to a different story now. A record 2.7 million people were referred for cancer checks in the last year. It comes after figures suggested that COVID pandemic saw numbers dramatically decline. So I guess, again, this is that catch-up, and this is why you've been so busy.
And it's fabulous that we've got more people coming forward. We've done a healthcare awareness with the government saying, look, these are the signs and symptoms that we need to look out for. Across many CCGs across the UK, there's been a vague symptoms pathway. So by that, I mean, if someone comes in and they just got these hodgepodge of symptoms and we can't seem to put it together, actually we can send them, fast-track them. And now with the technology and the tests that we've got, and also just awareness of the campaigns that have been going on. So we've had No Buts at ITV making aware of bowel cancer symptoms. We've had Sarah Harding, who sadly tragically passed away so young from breast cancer. Tom Parker from The Wanted, who died from brain tumour. So people's awareness is so much more, and social media drives that. But if you're at home sitting with any of these rare symptoms, then please pick up the phone. So bleeding from anywhere, coughing up blood, back passage, weeing, talk to your doctor, unintentional weight loss that you might have experienced that you just thought, I'm not trying to lose weight, bloating that's lasting and persistent for 3 weeks or so, a cough that is persistent for 3 weeks or so, night and flushes and sweats, which is ongoing and persistent, fatigue that you can't put your finger on, and lumps and bumps that you find anywhere, please have a chat with your doctor.
But at least 30,000 people are still waiting to start treatment.
And that is something that the government is completely aware of. And this is where there was a huge, I don't know, in the middle of everything, but there was this decide that we were going to open up more diagnostic centres. The problem is where are my oncologists, where are my nurse practitioners? It's the workforce, which NHS Confederation have said time and time again, that is the biggest problem that we have in the NHS. We just don't have the staff.
Last night, Davina McCall's second documentary on the menopause, which was brilliant, by the way, Channel 4, Davina McCall, Sex, Mind and Menopause. She was talking about that the one pharmaceutical company reported a 30% rise in demand for HRT products, which is great. It means the message is getting through. People are getting the HRT. However, there is a crisis because there is a shortage in the HRT and people aren't able to get hold of it.
And there are just absolutely fabulous campaigners who are doing so much work at grassroots level. We've got Diane Danzebrink and Make the Menopause Matter campaign. We've got the Menopause Mandate. You guys have had Dr. Louise Newson, who is just a dear friend and an absolute powerhouse when it comes to knowing about the menopause. And the pressure has been really on. Sajid Javid has now hired the first Tsarina or Tsar to sort out the shortages, Maddie McTernan. And the pressure has to carry on by these groups. There is a Menopause Mandate campaign, and please go on and sign it, because the more people who make a noise about this, the quicker we can sort out these shortages.
Yeah.
Millions of Brits dismiss signs of dementia in partners as old age.
Yeah, we've often done this. Dementia is just something that you have to put up with, and that really doesn't have to be the case. So if you've watched the Davina McCall documentary last night, she talks a lot about memory fog and the way that estrogen works in the brain. So just for that, please have a look. But we need to know that we need to be picking up the signs of dementia earlier, because actually a lot of it is preventable sometimes. So diet, exercise, good memory, cognitive puzzles, etc. And the thing is that the diagnosis of dementia is becoming far more common because we're living longer. It's a disease of age. And because we're living longer, we shouldn't have to put up with the fact that it's just old age and put up with it.
Well, you've got to now, apparently, you've got to walk faster. Walking faster may slow down ageing, so walk faster and drink tea.
Yeah, obviously I'm a huge tea fan. Not that I'm saying that will fix everything and your dementia, but exercise, it comes down to diet and looking after yourself as much as possible. I just wanted to go back to the dementia. If you've got a loved one at home who you're thinking, do you know what, I might be worried about their memory, they're forgetting keys, there's an online test that you can do for free called GP COG. So if you put GP COG COG, you can actually do the questionnaire with your loved one at home, and if it fits up any of the signs, then book an appointment with your doctor, because there isn't no test or blood test or a scan that we can do that says you've got dementia. But yeah, walking slower, weight-bearing exercises, and if you're going to drink tea, it has to be green tea. Black tea, sorry.
And no sugar, I bet.
Yeah, no sugar, cut down on milk, lactose intolerance, all of that, my love.
There's always a cat.
There is.
Thank you.
Thank you. Lovely to see you.